Is everybody ready? It's 10:30. We need to get started. Let me know when everybody's ready. All right. Good morning. I'm Ray Jones, Pike County Judge Executive, and we felt it was necessary to have a press conference to update the people of Pikeville and Pike County with regard to the status of the COVID-19 pandemic, in particular how it's relating to the delivery of health care to the people of our community. We have not had a press conference for some time. The mayor and I made a collaborative decision a few months ago that we would not have routine press conferences unless we had something that we felt was urgently important or an emergency situation for the people of the county, and we believe we are at that time. So before we bring up Ms. Tammy Riley, who is the Pike County Public Health Director, I'd like to ask Mayor Carter to come up and say a couple words.
Thank you, Judge. This, like the judge said, we talked several months ago that, we would not have these regular press conferences. And I think if anybody's been out there watching the news, reading the news, then you can see that we've got an issue here in Pike County, not all over in Pike County, but throughout the United States. When we were discussing some things earlier, I've been thinking about this for the last couple of days and how people are getting tired and worn down with the whole pandemic. And we all are. I know I am, and I know the judge is, and I know Tammy is, and Dr. Foddy, and everybody's just worn down with it. But the reality is that it's upon us now. It wasn't upon us back in March and April and May of last year, or earlier in the year. So thinking about how people are tired of things and how you feel like wearing a mask is you're violating your civil rights, and it just didn't make sense to me. But more I thought about it, back in the day, and I guess it was in the 80s, when mandatory seatbelts became law, people were saying the same thing. So wearing a mask, we're not asking you to take your civil rights away from you. It's just doing the right thing, protecting your family, protecting your loved ones, protecting your neighbors. I plead for everyone out there to wear a mask. When you see someone not wearing a mask, ask them to wear a mask. Don't tell them to wear a mask. Ask them to wear a mask. It's just the right thing to do. So I'll sit down now and we'll let the experts tell you where we're at and how we need to go forward. And I think Ms. Tammy Riley's first. Thank you.
Thank you, Mayor. So what I want to do, I want to start with an update on cases, and I do have some slides, some graphs to show to back up the information, the story that I want to relay to the public today, this morning. In Pike County, we currently have 1,333 cases. Now, this was as of late yesterday evening. Those numbers have already changed because all the numbers I'm giving you are changing rapidly, and that is part of the story of what we're wanting to tell you this morning. So 1,333 cases. 432 of those cases are active. 888 of those cases have recovered, and 14 are deceased. Now, of those 14, 5 of the deceased, they have been confirmed. And then we have additional reports, 9 actual reports of deceased that have been forwarded to the State Review Committee for confirmation. And we have received word that there are additional deceased this morning, and we are waiting for the reports on those. So that's where we are as far as caseload, recovered, active, and deceased. Now I want to focus on hospitalizations and show you where we've been and where we currently are. For hospitalizations currently in Pike County, this was as of yesterday, we were managing 70 COVID patients in our hospitals in Pike County. Of those 70 patients, 40 of them were Pike County residents. The hospitalizations represent an age of from 33 years of age to 93 years of age. That's a wide gap in age range. So we have young, middle age, and old alike suffering that are very sick enough to be in a hospital with this virus. We have 40 and 50-year-olds, as I speak, in our hospitals on mechanical ventilation. Those are very sick individuals. Our ICU bed capacity or occupancy on Monday was at 98% and has continued to be high. So our hospitalizations have definitely played a factor in our concern and part of the reasoning behind our communications this morning. Hospitalizations, when you look at the data, and there's a graph that you're probably looking at, when you look at the data of hospitalizations and how that has trended, if you look back to the end of September, after about 2 weeks after the Labor Day holiday, we were at 2 hospitalizations. In a matter of 2 weeks, we went from that September 21st date to October 12th. We went from 2 hospitalizations, we've been in single digits throughout the pandemic, to 22 hospitalizations. 2 to 22. That number has continued to rise. Hospitalizations within just a few weeks now, from that October date to where we are now, we've seen exponential growth. On Monday, we had 45 hospitalizations. Today, we have 40. That's the Pike County residents that are hospitalized. The reduction in this number from 45 to 40 is not due to recoveries. We are starting to see more individuals not recover from this virus. I want to talk just for a couple of minutes about the benchmark data and the state incident map. The first one will be the benchmark data, slide 3. That is data that I share with our judge executive and our mayors on Monday mornings, just to keep them informed in the trends and where we're going. This past Monday, I also met with the task force committee, which is community leaders across the county. They cover all sectors of our society, and I share this data with them during those task force meetings and every Monday with the judge executive. But as you can see, as I mentioned, the hospitalizations were at 70, 40 of those were Pike Countyans. Our ICU occupancy was at 98%. I'm going to share a personal story in just a minute to really hit home why this number being so high is so important to everyone. Also, the ventilator capacity was at 45%. Case growth, I'm going to talk just for a minute about case growth. We grew 35%. Our caseload went up 35% in a 14-day period when I captured that data on Monday morning. Our positivity rate, look at that, it's 6.49% for the last 7 days. Now, I calculate both antigen and PCR, and that's data that's reported to me locally, and I only use the data from the providers that I get reliable and regular, consistent data from, but based on those providers, we were at 6.49%. We were at 1% for weeks and weeks, for months. So we've definitely seen a trend there. And then there's the daily incident rate, that last metric. And you can see we were at 46.9% yesterday. It's already gone up this morning. So if you look at the daily incident rate map, which is slide 5, you can see there that most of the counties across Kentucky are red. We've been red for many weeks. You can see there at the top that our daily incident rate as of this morning is 51.8. And I'll just spend just a minute to explain that. It's the number of cases you're averaging per day over a 7-day period. But then we normalize the data and say, well, how many cases would that be for every 100,000? Because that way I can compare our data to Fayette County, to Jefferson County, to counties in western Kentucky and southern Kentucky. So when you look at our benchmarks and you look at the daily incident rate map, you can see that our trends are going exponentially in the direction we would not want to see them go. So that's the benchmarks and the daily incident rate map. So what does this mean for you as an individual? What does it mean for our families, our community? I'm going to share a personal story about how my family could have had a really different outcome yesterday. So I had an immediate family member that had a heart attack, and he was rushed to the emergency room. This was yesterday. And then he went from the emergency room into for a heart catheterization, and he required an emergency angioplasty procedure. And during the recovery process, his blood pressure dropped dramatically, and he suddenly required ICU care. And it was vital for him to receive that care, and he did receive that care. So our outcome has been a positive one. He's in being transferred to a regular room this morning, I've been told. So he saw the ER doctor. He had access to the surgeon for the procedure, the ICU doctor and nurse. They weren't sick. They were there. That bed was available. But what if along that route for the recovery, one doctor had been too sick and the ER was not able to take him, or that bed hadn't been available? Our outcome would have been very, very differently this morning, and that's what we're all here to try to prevent, and that's what our story is today. So what can we do? What can we do? The plan is simple, yet it's effective approach. We do have the necessary resources and tools available to us to reduce the impact of this virus on our community. But what we do today, how we decide to manage our behaviors, whether we decide to sacrifice little conveniences or not, will determine our fate and the ultimate impact of this virus on our local healthcare system. We have the state's red zone reduction recommendations. We have our 5C plan. We have some wonderful tools that are effective. It's a community-wide accepted plan and approach that will reduce our numbers and enable our healthcare system at least to manage the spread that we are likely to see. So I want to talk about next the 5C plan. You have it there. You have it there in front of you. I think everyone in the community is aware of the 5C plan, which is remain calm, do your civic duty, get a test, do what you're supposed to do, stay away from others if you're sick, go get a test if you need to get a test, but remain calm. Get your information from reliable resources. Go to PikeCountyHealth.com, go to our web Facebook page, go to kycovid19.ky.gov. That daily incident rate map, by the way, that we showed a minute ago, it's there and it's updated daily. So the public has access to that knowledge. Long-term care congregate setting incident rates is public knowledge. The schools, both secondary and post-secondary's information is there. So stay calm and get your information from reliable resources. Clean your hands, clean high-touch traffic areas twice as often, twice as long. Cover your face with a face covering when you're outside your household. And if you're going to be within 6 feet of others for any amount of time outside of your household, wear a mask. And then finally, contain. If you're sick, again, go get a test, stay home, stay away from others until you've either been released by public health or you've ensured that you've kept everyone safe in your family and in your neighborhood. So that's the 5C plan. But let's talk about the red zone reduction. Now, the red zone reduction plan, and that is I believe the 6th slide. And it's the 6th slide, and I really want to spend a minute to talk about that. The red zone reduction plan goes back to that state incident rate map. So when we go to 25 cases or more per day on an average for a 7-day rolling average, the State Department of Public Health is asking that communities follow these red zone recommendations, and that science and experts tell us that if we will follow these recommendations with unity, in unison, in harmony in the community, as much as possible, that is the fastest path to seeing a reduction in your numbers. So what are the recommendations? Employers, we're pleading with you, allow employees to work from home when possible. Non-critical government offices to operate virtually. Reduce in-person shopping. Order online. We have wonderful retail stores in this area. They'll load the groceries in the trunk of your car for you. There's no touch possible. You can order online. You can request that curbside. Most businesses are offering curbside. So reduce in-person shopping. Order takeout and dining in restaurants and bars. I still frequent the restaurants in this area and give them my business, but I do grab and go takeout, or I find a nice outdoor area for my family and I to enjoy our dinner. The next one I cannot emphasize enough, and I'm going to explain why. Prioritize businesses that follow and enforce mask mandates and other guidelines. As a public health department, we are underfunded, under-budgeted, understaffed, and we're getting so many calls every single day from well-meaning citizens making us aware of non-compliance. We cannot possibly, the mayor, I'm sure, would back me up on this, the police force cannot possibly chase down every single complaint. We just don't have the resources to do that. What I need is for the general public, prioritize businesses that make you feel safe. If you walk in a business and they're not making you feel safe, leave. Leave. Now, you can politely maybe call the manager after and explain why you left, because we always want to remember to be kind. Everyone's under stress. But don't frequent businesses that make you uncomfortable. How many times I've received a call, well, I was in blah, blah, blah business, and, I was in this situation, I didn't feel comfortable, and I just want to say, well, leave. Call the management. Don't go back if they don't correct their actions. So prioritize businesses. Reschedule, postpone, or cancel public and private events. It's these gatherings. Do not host or attend gatherings. It's these personal gatherings where individuals are not in a controlled environment, like in a classroom or a work environment where we know they're wearing masks and staying 6 feet away. It's personal, family, and social gatherings where we're seeing most of the transmission. Avoid non-essential activities and reduce your overall activities and contacts. Every time I do something, I think about what the consequences could possibly be. Is the risk worth the reward for me? Is this a small inconvenience that I can pay that will create a larger reward for my community down the road? So my prayer today, it's my prayer that everyone makes the connection between the concept of loving our family, our friends, our neighbors, our community, with the idea of protecting them by following such a simple plan as the 5C plan. So thank you, Judge Executive Jones. Thank you, Mayor Carter, for allowing me time. I know you want to walk.
Just briefly, yesterday morning, Dr. Fadi Alacross, who's the chief of infectious disease at Pikeville Medical Center, sent me a text, and he felt that it was time to have another press conference. And you're going to hear from someone who's been on the front lines dealing with this pandemic since day one. And this is the man that if any of us get sick with this virus, this is probably the person we're going to have to look to hopefully save us. And as Tammy said, the numbers, there's been some question about how the state's numbers differ from the local health department numbers, and there's a lag. So as I understand it, Tammy, some of the numbers for certain testing facilities get reported to the state first, others get reported to the local health department first. But as of today, we're somewhere near 19 or more deaths in Pike County. And last week at the fiscal court meeting, I announced that a friend of mine passed away, no prior health problems. And as Tammy said, we have people in the hospital ages 30 to in their 80s. I do want to point out that this is not about trying to control the public. When we made the decision not to have door-to-door trick-or-treating, there were people saying we're trying to control us. No, we're trying to keep people from getting sick. We're trying to keep kids from getting sick. We're trying to keep kids from bringing it home to their parents, their grandparents, or caregivers. And that is something that should concern each and every one of us. Last week I saw, or earlier this week, that the KHSAA has postponed the high school football playoffs for a week. The Pike County school system, as I understand it, is gone to virtual school right now till this calms down. This is something that if we don't work together, it's going to shut down our economy, it's going to shut down our schools, and it's going to cost people their lives. But I really think it's important that each and every person that watches this or watches it at some point in the future, and those of you who are in the press, need to pay attention to the message that Dr. Fadi has. Because not only is he there to take care of people, he's putting his life on the line every single day, as are many other healthcare professionals throughout Eastern Kentucky. So at this time, I'd like to ask Dr. Fadi Alacross to come up.
Good morning, everyone, and thank you, Judge, for that opportunity to talk to public and emphasize on the importance of all these public measures to help with that crisis. So bear with me, I need some time basically to talk about the situation, and hopefully we send all the time positive message here. It's about being calm, about sending the right message, because our job is to educate the public to do their part and to be able to contain that crisis. So we are in a race every day, not only to make the vaccine, but unfortunately to set a new record when it comes to the COVID-19 cases. So almost 10 days ago, if you look at the numbers in the United States, 100,000 cases, and if you look at the number yesterday, 140,000 new cases. So we have increment in the number of cases, and that increment is exponential. So definitely we're dealing with some sort of spike, and if you look at the number in the United States, we already surpassed the 10 million cases of COVID-19. So what does it mean to all of us? The only answer will be that we're not in control, the virus is in control. And unfortunately, the rules are the same. They haven't changed since day number one. We know that mitigation measures are the best weapons to combat the virus, but it seems that we are relaxing our behavior, and that's why we've seen increase in the number of cases. But that's fine. We can definitely emphasize all the time about the right message, about all these mitigation measures, and hopefully we can counterattack that virus and we can back again to a safe area and safe zone. We are afraid that that virus will double fast, and there is some projection, if you look at the country projection, that at a certain point in the future we may hit the 200,000 cases per day. And this is definitely alarming and not acceptable, because the number by itself doesn't mean nothing. What's important to us, it's how many patients are going to be in the hospital, how many patients are going to die, and this is becoming the most alarming situation. And currently we see a spike as well in the number of deaths and the number in the hospitalization. So the problem as well, that the numbers that you have today, it's reflecting the number from a week ago. And I'll explain it just in a very simplistic way. The incubation period, or the cooking time for the virus to be infectious, it may take up to 5 to 7 days. So whatever number you have today on the record, this is coming from last week. And the number from today is going to be reflected next week. So keep in mind that kind of possibility. And the more you relax your behavior, the more that number is going to increase. So this is a snowball situation, and the trend of cases is growing exponentially. So please allow me to talk a little bit about the cases milestone at Pikeville Medical Center. So if you look a month ago, October 13, 2020, we had in our facility 16 cases of COVID-19. That situation has drastically changed. And if you look at the numbers today, very alarming. We are now at 849 positive cases from PMC testing alone. We have 67 patients currently in our COVID unit. We have 21 patients in the ICU and 15 patients in the mechanical ventilation. So these numbers are shocking. They are completely changed from last month. So the pace has drastically changed, and we have to definitely adjust to that number by doing our part to be able to cut down on the spike and on the increase of these numbers in the county as well as in the state and in the nation. At PMC, we're trying tirelessly to expand that surge by trying to find more rooms, try to get more staff, but this is becoming really challenging to be able to take care of COVID, in addition to the other patients that require also other care, especially at PMC, which is almost 350-bed institution, and we're providing most of the services. So here, keep in mind that COVID-19 not going to only impact the COVID patients, but is going to impact as well the patients who are not COVID, because if these patients are going to occupy most of these rooms, what's going to happen for elective surgeries? What's going to happen to people having trauma, coming to the ICU? What's going to happen to people like having a heart attack? They need some sort of care. So this is going to be becoming a very stretched situation, and we have to pay attention to that. And we have to work all together to be able to achieve the victory. It's going to be a long time. It's going to be probably many months or many years from now, but at least we need to start now to stop the spread of COVID-19. So that's why we call it the paradox. From no cases to hundreds of cases, That's basically the tricky part of COVID-19 because SARS-CoV-2 is very contagious and it spread at very high speed. And anytime we're talking about 25 new cases per 100,000 population, we're going to make the job of Mrs. Raleigh very hard because part of containing the situation of COVID-19 is the tracing mechanism. If I cannot do tracing mechanism, I cannot control the situation, and people can spread the infection from one person to another person. And keep in mind, 40% and more of the patients with COVID-19 are totally asymptomatic, and these patients can transmit the virus inadvertently to the others without paying attention. So that's basically the enigma of the COVID-19, and that's why we ask for everybody to mask up, put the mask on, hand hygiene, social separation, especially in confined places, in public. These are the best tools and the best weapons we have now in our arsenal to combat COVID-19. Hopefully, the vaccine is coming soon. We have great news about the vaccine. It seems to be very promising, but it's not going to happen tomorrow. It's going to take time, and the vaccination process is going to come in waves. So we have to be patient. I know this is a very frustrating and very depressing situation, but we can definitely go over it together. And again, think about that situation. It's the only way we can defeat COVID-19 when we think about we. It's not about me. So it's going to be a collaborative effort, and hopefully we'll be able to achieve that victory. So the goal here from that committee is to empower people with knowledge, because we need you to do your part. Without you, we cannot basically succeed. So we're going to basically send, again, positive message. We need a clear message. We need scientific message and statement here: masking, hand hygiene, social separation, cut down on a gathering, especially a lot of people, is going to basically cut down on the transmission. And this is how you save your loved one, yourselves, as well as the community. So let me talk a little bit about some of the challenges as well in the hospital here. I already talked about them, but if you look at the numbers across the nation, we have 30% increase in the number of hospitalization over the last 2 weeks. And again, one more time, now in PMC with 67 admission with COVID-19, 21 in the ICU, 15 on the ventilator, and 7 new patients overnight. These are definitely very alarming numbers. And again, as you see that the number is basically keeps growing, more people becoming sick. So we don't want that. We need to protect our patients. We need to protect our friends, our loved one, and this is going to come to you to do your part to help basically cutting the spread and stopping the spread. And Donovan Blackburn did very nice update a few days ago, and please watch it. He talked wonderfully about the situation at PMC, and I think ARS should have the same situation, and then we'll be talking about that as well. So we are being stretched, and we need to provide the right care in our area. We don't want our patients to go somewhere else. When you need the hard care, we need to stay here. We don't want to basically transfer somebody somewhere else and sometimes to a different state. This is not the intention here. So let me talk also about something else that we've started to see. So we're talking now about the tail of COVID-19. And here we're talking about not only the admission, what's going to happen after admission, and what's going to happen after being infected from COVID-19. Now we see the tail, and we see the lingering symptoms of COVID-19. People coming now still having difficulty breathing. And this problem may happen after a few weeks, few months. Nobody knows exactly how long it's going to stay. Other people are suffering as well from fatigue, chronic fatigue syndrome. So even if you rest, you're not going to get your rest. Having brain fogginess, headache, depression, anxiety, especially people are being on the ventilator and survive. They're having post-traumatic syndrome, in addition to cardiac events. So we are seeing long-term consequences of the COVID-19. And if you look at the CDC report, 1 in 11 admission to the hospital for COVID-19 is going to be to readmitted again. So here we're putting too much burden on the healthcare system, and especially when you have the flu intersecting with the COVID-19, it's going to be a truly challenging situation. So I'm going to take the opportunity today to emphasize on the importance of vaccination for the flu to protect you at least for the flu and prevent other problems going on in your body, as well as the risk of transmission to the others. So again, try to do your best, protect yourself, get vaccination for the flu, and do all the measures that I've been asking for that will help the transmission. So this is basically the time to talk about the gravity of the situation, but in a very nice way as well. This is not a snooze. This is a wake-up call. We need to take all the steps to combat the virus. We need to achieve our victory. And again, masking, social distancing, hand hygiene will continue to be the best weapons that we have. Vaccine is coming, as I mentioned, but it's going to take time. So until we get the vaccine, hopefully the situation will be solved, but it's going to take time. It's going to take a few months. I don't think like the population will be fully vaccinated before mid-2021 or probably at the end 2021. So we still have time to work on the spread of the virus before having the vaccine available. We need to put that virus in a cage to gain our freedom, and we cannot do it without you. So you are the most valuable players in that game to be able to achieve the victory. We need to follow these proper measures because these are going to be the only way we can cut down on the number of the cases of COVID-19. So that surge comes at the approach of the holidays, and I'm going to talk about it very clearly. So we know where there is Thanksgiving coming, Christmas, New Year, and this is the time when people, they gather. They gather in a large number. And I want to take the opportunity here to talk about that problem. It's very lovely to have people around you, but this is the time when you have to cut down on these gatherings. Because when you gather in confined places, especially in the wintertime, when you have the heat, when you have the dryness in the air, this is when the virus is spreading the most. So please listen to us and try to cut down on these gatherings. Try to limit these gatherings to the minimum possible. Try to protect yourselves. Try to protect your vulnerable one. Keep in mind, if you look at our population, most of them, they have risk factors: diabetes, heart problem, lung disease, smoking, vaping, you name it, you find it. This is basically more important than ever to try to protect this population, because if they catch the infection, they're going to have a lot of complications. We're not ready for that. We need to protect everybody, and that's why we're sending that kind of positive message. Please do your part, and hopefully we can combat COVID-19. And again, we said that several times, the greatest commandment, loving God and loving neighbors. So take the time to show kindness to each other and protect to each other, and may God protect you and shield us from all the harms that can happen to us in the future. God bless.
Next, I would like to ask Dr. Maria Brayman, who is the Chief Medical Officer for the 13 hospitals in the ARH healthcare system, to come up to speak on behalf of Tug Valley ARH. We have a lot of people in Pike County that do, that's our second hospital. It is also, they have also seen a significant number of COVID cases at Tug Valley. We've got a lot of Pike Countyans that go to other hospitals in the ARH system. So we wanted to ask Dr. Brayman to come over and give us an update from ARH's perspective as well. Doctor, thank you.
Thank you, Judge Jones. So, excuse me, ARH, as already mentioned, is a 13-hospital system. 11 of those hospitals are here in Eastern Kentucky. And we serve Pike County residents primarily through our Highlands ARH and Tug Valley, which is located in Williamson. And really the message that I want to give today is that in the state of Kentucky, as well as our nation, but certainly in Kentucky and Eastern Kentucky and all of our hospitals, we're seeing a significant increase in COVID-19. I can report today that our Highlands Hospital has, our ICU there is full. They have over 20 COVID positive patients. Our Tug Valley Hospital lost 2 patients in the last 24 hours from COVID-19 and has 6 additional COVID positive patients there. They are only have, I think, 2 right now. Well, I shouldn't say only, 2 people on the ventilator is too many. So we are, throughout our system, seeing an increase in patients. We are concerned because what that means is, as we're approaching the holiday season and flu season, that all of these things that have already been talked about, we're worried about facing across the entire Eastern Kentucky region, which means that not only are we going to see hospitals in areas start to get overwhelmed, but we could start to see all of our hospitals become overwhelmed. And that's not a position that we want to be in. We want to be able to serve our people. So we plead with our communities, certainly with the Pike County community and with all our communities throughout Eastern Kentucky, that we know how to keep each other safe. We keep each other safe with some simple tools, and those tools are our mask, social distancing, washing our hands, and decreasing our social gatherings. You know, I have 3 teenagers myself, and I know how hard that is. I know how hard it is on them, and it's hard on us as a family. But it is so important for us to sacrifice on behalf of each other, on behalf of our community, to keep each other safe. So really, we plead with you to do that. As a system, ARH is here to work with all of our sister hospitals, with PMC, with UK. We are working actively with UK because they are seeing an increase in COVID positive patients, and they need to get patients back to us. So we are working actively with them to help reduce their burden. So we are all working together to serve the needs of our patients in all of our communities here in Eastern Kentucky. I will also say God bless. We wish everyone well. Please get your flu shots. Please mask up. We can do this together. Thank you.
Thank you, Dr. Braman. At this time, I'll open the floor up to questions, and I guess we'll start on this side. Buddy? Anybody?
So for PMC, at this point, what is the occupancy of your ICUs?
I'm sorry, say it again.
Your ICU occupancy at this point?
So the question is about ICU occupancy. Here, we have the capability we have the space, we can do ICU. However, we have to do it very diligently to make sure that we're providing the right care for our patients. At this point, we have several ICU, but the people in the COVID unit, we have 21, 15 on the mechanical ventilation. We're trying our best to cooperate and find places for the surge and try to find the right staff to do that. But again, this is challenging. That's what I'm saying here. So adding more COVID patients to what we have at this point and what we serve here for the area, putting a little bit more burden on us, but we're trying our best. The team is doing great. The administrative team, Donovan and the rest of the team, they're doing a great job to find that space and try to find ways to serve our patients with COVID-19 in our hospital.
I was going to ask you, with PMC, have you all expanded and created a COVID-19 unit? I know you've mentioned it a couple of times, and just tell me what the occupancy is and what you do there.
So we have basically increased the number of beds for COVID-19. We have the COVID unit on the 6th floor, and now we're trying to put another one on the 7th floor. And again, here we have to serve our community. We have to take care of our patients, and it's going to be the best way to do that. We're trying our best to staff these rooms and these locations with very skilled nurses, and we have the infrastructure to do that at this point. So at this point, we have 67 patients with COVID-19. As I mentioned earlier, 21 in the ICU and 15 patients on the mechanical ventilation.
Anything else for Dr. Pike? Any questions for Dr. Braman or Ms. Riley? Tammy, I think it is important if you would update us on the situation with our nursing homes. If you could update us on our nursing home situation. We have had a substantial number of cases develop in our long-term care facilities that has resulted in several deaths of nursing home patients. I think it's important that Tammy would update us on that just briefly. But any other questions for Dr. Braman? And if you have any other questions for Tammy, she can address those.
That was good timing. Yes, so one of the factors that's impacting our community currently is we are having long-term care outbreaks and in multiple skilled nursing facilities. They're called skilled nursing facilities, long-term care centers. But when I'm looking at the caseload, for example, 432 active cases, about 150. And again, those numbers are changing rapidly on me. I worked all day yesterday. It's a state office. We were closed. Staff was in the office working, so that the numbers, we can't take a day off as the numbers just get too rapidly ahead of us. So we were there working, and it was a little over 150 of the active cases are long-term care associated. Now, some of those are staff, and that's from a variety of three locations. And when you're looking at the deceased, we have 5 confirmed, and we have forwarded an additional 9 death reports, and those 9 are long-term care associated. 8. So we have 6 of our deaths of the 14 that are not long-term care, and then the remainder are long-term care associated. So there's really a variety, but those numbers are impacting our active caseload and the deceased, those poor outcomes, but those numbers are also coming from just the community as well. Any other questions regarding? Yes, Buddy?
So as we go into the holidays, obviously, family gatherings you mentioned, those are going to happen. During the PMC news conference, Donovan mentioned that their family maybe plans to do something outside. Is there any guidance you could give for options like that?
There are Thanksgiving guidance that the State Department of Public Health released yesterday. It's on the kycovid19.ky.gov website. What I would encourage, we're in a hot zone in Eastern Kentucky right now. And what I'll say is, I said in an interview to you last week, is what we do today is going to influence and impact where our numbers are, and when I say numbers, I mean outcomes. I mean the number of people in our family who are in the hospital, who are on mechanical ventilation, and who have the poorest outcome of all as being in those deceased numbers. What we do today will influence where those numbers are by Thanksgiving. It takes 2 to 3 weeks. Dr. Foddy, I'm sure, would back me up on that. It takes a minimum of 2 to 3 weeks of our behaviors, a shift in our behaviors to start impacting those numbers. Because where we are now, next week's, that story's already told, because our actions today impact next week's numbers. So what I'm saying is, what we do today will impact Thanksgiving. And it just will not be recommended that multi-generational families get together under the same roof. Now, my own mother asked, well, could one group come in and then leave, and then the next group? And I'm like, well, then everyone in our family is going to expose you. There's not really a good way to approach that. You can do Zoom, and everyone eat in their own kitchen and do a Zoom call and laugh and tell family stories, and there's some outdoor potential, but it's very difficult. And where we are, we're in a very delicate situation where we are currently, almost at a tipping point, I would say. Would you not agree, Dr. Foddy? Yes, ma'am. We're at a tipping point. So if we want to be somewhere even darker than where we are right now by Thanksgiving, if we don't want to be there, we need to change our behaviors today. Did that help? Thank you.
I believe, listening to all the experts today, that you can see we're at a crossroads. And as Tammy just said, if we don't change our behavior, we're going to be in trouble, worse than what we are today. You might want to think about, do you know somebody or have known somebody, a family member or a friend, that's contracted it and or have died? This is very small right now. If we don't do something, and I'm not being an alarmist, I'm being a realist at this point right now. If we don't do something about it, our behavior, it's going to be bad. You think you don't want to get together for Thanksgiving? Christmas could be a whole different story, and we don't want that. We do not want that. So please, mask up, Pike County. Let's do the right thing. Let's help our neighbors and our families. Thank you all for being here.